What this does is it's allowed me to double check with the patient. This is really what you're taking. You know, it does drug interaction checking and make sure everything's okay. Once it's in there, then when the patient comes next time for their repeat, I talk to them, I check their blood pressure, do whatever I need to do. They need that one, and that one refilling, click, 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 print, prints out, sign it, and away it goes. Pharmacists can read it. There's very little chance of error. So again, a huge improvement. It makes my life easier, makes the pharmacist's life easier. The number of phone calls I'm getting from pharmacists because they can't read my handwriting has gone to practically zero.
It's very exciting. It's very interesting. We're actually learning, continuing to learn every day something really new and nifty to do. And it's efficient, and it makes you feel a little bit more confident of what's happening because everything's right there. There's no wondering, and again, searching through the charts just always took so much time. So I think people are missing out unless they have this.
Now what we can do electronically is send them a task, give the doctor the information about why they need to call the patient. The doctor calls the patient, he makes note in the encounter that he's called the patient, what he's done and what he's discussed with them, and all of that whole tracking system is recorded in the patient's medical record.
Top benefits would be streamlines time efficiency for me, definitely. Very legible, so that again, amongst all practitioners, that's fantastic. I find the visual ability to show my patients what's going on, that they find that very beneficial, much better take-home message for them. And honestly, I just can't imagine doing it any other way. I think it's fantastic as far as everyone working together as a team. It allows people to work as a team.
So, you know, sometimes patients need to know, well, when did they have that surgery? Before we'd have to thumb through, you know, reams and reams of paper to find the date. Now we can, that's just automatically in there. As we enter it, of course, it has to be entered, but it's at a glance. We can go to their summary, you know, and have a quick look and see when when that surgery was, or when was it that they had their last flu vaccine, or when was it that they had this. You know, these kinds of things are important to patients to know, and they don't always write it down. We're going to have this great record for them to find out those things.
It's not just about charting. It's about graphs, it's about pictures, it has so much more, and it does take a little bit of time to learn all that, but once you get it, it's very efficient, very quick. I mean, to go home and finish up or pre-plan for your week to streamline your next day is incredible. To log on for 15 minutes, and it makes a huge impact.
I would have no hesitation whatsoever now in 2010 in telling other doctors that this is something you should do. 5 years ago, I would have had a lot of hesitation, which is why I didn't do it, because I don't think we were there. With the way information flows into us now, particularly in Kelowna, in the Okanagan, I would say absolutely it's incredibly beneficial for you as a physician, for your staff, and absolutely for your patients.